So, welcome to India Top Doctor. As you know, today we are here to
Morning.
talk about patients' education in diabetes. But before we start there, how do you educate a patient with diabetes?
See, first of all, I would like to give a few facts about diabetes. Diabetes is affecting almost 463 million people across the globe. So you can imagine the severity of the problem. The prevalence is more in urban areas rather than rural areas, and more in higher income groups. So India to have a diabetic population, so we need to educate our patients. So what is therapeutic? This patient education is a set of therapeutic activities, conducted by the health professionals, basically aiming at the patients and patients' relatives, friends, and close acquaintance to acknowledge them about the disease process, the pathophysiology of the diabetes, monitoring of blood glucose levels during the disease process, as well as to all the efforts to prevent hypoglycemia or hyperglycemia during the management of diabetes, so that we can prevent the complications of the diabetes also and give a good quality of life to the patient. Yes.
All right.
And
so, if you can tell us
so
about
these are the, yes, actually what happens, diabetic education is a part of diabetes control program, which not only includes the patient education, but also includes the, public health education also, and health education of the public in diabetes, as well as, we have to organize our primary health care, targeting that particular population. There are different cultural practices, cultural specific, things related to the population. Suppose in South India, they eat more rice. So this is kind of characteristic of the population. And, so we have to see the cultural practices over there. We have to have a good communication with the community leaders and good social interactions while conducting this diabetes control program. So we can achieve our targets, and we can prevent the primary all these non-communicable diseases have a two-stage of prevention. One is primary prevention, means you try to decrease the incidence of the disease, means onset of the disease by certain measures, like diabetes happens in high risk what is the high risk population for diabetes? Like patients who are obese, overweight, or patients who are like having family history of diabetes, or who are having specific ethnicity, like South Asians, Hispanics, and gestational diabetes history also important. So suppose you educate the patient that these are the various high risk factors, and then they can understand that how prone they are to develop diabetes. So this is the thing, like you have to teach them about the symptoms of diabetes. What are the different symptoms of diabetes? Like patients they say ki, we don't know हमको diabetes हुआ था. So what are the symptoms? Like polyuria, increased frequency of urination, polydipsia means increased thirst, polyphagia means increased hunger, weight loss, and irritability. These are the basic features related with the increased frequency of infections too. Suppose somebody is having some wound, it is not getting healed in the time period. So that is the thing, like we have to acknowledge the patient about the risk factors as well as the signs and symptoms of diabetes, how to diagnose the diabetes early. And after the diagnosis of diabetes, self monitoring of blood glucose is also a very important part, which we can do at home with a simple glucometer as well as CGM, continuous glucose monitoring technique. So we get a time in range glucose targets.
All right. So we also got a basic purpose of diabetes education. Is there any other major purpose for which
we have to empower and make the patient self-sufficient for the management of diabetes? That is the self-empowerment of the patient is very important. You have to shift the paradigm shift from the health professional feeling responsible for the diabetes management to the paradigm shifting towards the patient feeling responsible for his or her health condition. Patients should be involved actively in the management of diabetes. then only we can prevent the acute and chronic complications of diabetes, as well as we can improve and maintain the quality of life of the patient. So self-empowerment is very important. This self-empowerment comes from the various factors, like, you have to, like American Association of Diabetes Educators have given 7 care principles for the diabetes education. One is give diet according to the patient's requirement. Okay, we should give medical nutrition therapy specific for the particular patient. Okay, increasing their physical activity levels too. We have to teach them how to do the self-monitoring of blood glucose, how to take care of the feet, or regular physical, what is the importance of regular physical examination, regular eye checkups. You have to, because all these problems, they do occur during the course of the natural course of diabetes. We can always delay or prevent, at least we can delay the onset of these complications. So hypertension, heart problems like heart attacks, strokes, they are very common in diabetic population. So we have to teach the patient like to control your blood pressure, your cholesterol levels, lipids to be under control. Weight management is very important aspect of the diabetes control. Like suppose a person who is pre-diabetic, if we ask them to lose almost 5 to 7% of their weight, so there is a way like we can prevent the onset of diabetes 2 in a pre-diabetic patient. So weight management is very important. See, once you are targeting lipids, you have to think about the bad cholesterol, which is the LDL. We have to keep this LDL range below 100 milligram per deciliter. And we have to start therapy, and a good cholesterol range should be more than 50, but it is very rare in Indians to find good cholesterol more than 50 milligram per deciliter. And triglycerides range is normally should be less than 150 milligram per deciliter. You know what? The patients who are having a long-term hypoglycemia, or who are, hypoglycemia, marked hypoglycemia, their triglyceride ranges, it peaks, it rises. So if once you see that triglycerides are high, you should not start immediately treating that patient for the triglycerides. You have to control the blood sugar first, then you can start therapy for the triglycerides. But for statins, for LDL cholesterol, if the patient is high risk for diabetes, like patient is having hypertension, patient is having microalbuminuria, patient is having some kind of heart problem in the past, we can always start statins in a patient who is more than 45 years of age and having risk factors for the diabetes or diabetes complications. So, so basically the principle of patient education is to train the patient in every aspect of clinical care, starting from the initial assessment, to the history taking, clinical examination, diagnosis of the disease, as well as management of the diabetes. And now you say, what is the management of diabetes patient can do? Suppose patient is monitoring his blood sugar, and suppose he misses a meal. Suppose he is exercising more or skips his meal. So suppose he's having the symptoms of hypoglycemia. What are symptoms of hypoglycemia? Patient feels very weak, tired. There is increased palpitations, trembling, sweating. Patient may feel dizzy, blurring of vision. So if he checks his blood sugar, which is less than 70 milligram per deciliter, so immediately he has to have some kind of sweet thing, whatever is available around, like 1 tablespoon of sugar with water will also do, and half cup of fruit juice or any kind of sugary juice available around, sugary liquids we can take during that period. And after 15 to 20 minutes, he has to check it again, how much is the blood sugar level now. If suppose it is above or almost more than 120, no need to check it further. But suppose the patient is having further, this is around about less than 70 milligram per deciliter, he has to have something more. And suppose patient is having less than 54 milligram per deciliter of blood sugar level while checking on glucometer, it is a sign of moderate severe hypoglycemia. Then the patients may have some cognitive disturbances also. So patient should immediately check the medical help for that. So these are the symptoms of hypoglycemia, as I mentioned to you. Yes.
All right, ma'am. So that's all we talked about the issue. But what can you educate your patient with diabetes on to help prevent the complications?
Yeah. So as I mentioned that diabetes is a major cause of death, almost ninth leading cause of, it is a chronic disease which is causing almost 1.5 million deaths across the globe every year. So it is a huge number, and 3 to 4 times there are increased chances of heart attack and strokes in diabetic patients, increased incidence of foot ulcers and diabetic neuropathy, and peripheral vascular diseases are more in diabetic patients, and this leads to increased chances of limb amputation and retinal problems also. So diabetes is a major cause of blindness across the globe. So what can we do for the management or recognition of these complications in the early course of the disease? So what we can do, like, for patients who are having high risk factors like family history of heart disease or dyslipidemia, hypertension, they should be evaluated properly. Okay. Once they are and they should be asked to do lifestyle management for the weight loss, as I told you, and physical activity. Suppose somebody comes to me, he's asking, doctor, can I start with the physical exercises or exercise, any kind of gym or any kind of aerobic training and all. So first you have to evaluate the patient properly. You have to do certain tests to find out the patient's, is having baseline ECG or stress test to rule out any kind of major cardiac issue, with the patient. So then we can ask him, you do moderate intensity exercise for 150 minutes per week. Like if he is all right, regarding cardiac point of view, he can increase the intensity of the exercise too. That will help in weight loss and other problems always, that is helpful. So physical activity is also a major part. And regarding the food choices, we have to have carbohydrate portion control for a patient with diabetes. So we can teach them that it should be around about 55% of your total meal, like fat and protein should be 15 to 20%, and fat should be less than 30%, of your total caloric intake. So when you are considering diabetes control, not only carbohydrate intake is important, carbohydrate content is particularly important for the type 1 diabetes. What is type 1 diabetes? What is the difference in type 1 and type 2 diabetes? Like in type 1 diabetes, you have insufficiency of the insulin, or your body is not able to produce insulin at all. In type 2 diabetes, which is the major cause of diabetes in India, it is 90% of the patients are suffering from type 2 diabetes. Then they are having increased insulin resistance, which is related to the metabolic syndrome like obesity, hypertension, obstructive apnea, all these, related to the metabolic syndrome. And they have, and there are other types of diabetes, and they have insulin resistance and decreased insulin secretions also there in type 2 diabetes, as well as there is increased hepatic production of the glucose also. Hepatic is liver produces more glucose in these patients. Besides these two types of diabetes, there are other types of diabetes too. Like 1% of having patients, the MODI type of diabetes. What is MODI? MODI is maturity onset of diabetes in young. So this is a genetically based diabetes. Suppose some patients comes with early onset of diabetes, less than 25 years of age, and patient is having a parent who is having diabetes, and his generation of one or two generation is affected with diabetes. So you have to evaluate the patient for the MODI also, because these patients, they are not very obese, not very obese patients. They are. So you have to investigate these patients thoroughly and rule out this kind of problems, because these are not totally insulin insufficient. They have, they don't require insulin the way the type 1 diabetic patients require. So if you evaluate them proper, you treat them proper, they will respond to treatment very well. And other types of diabetes include the patients having some kind of pancreatic problems like chronic pancreatic insufficiency, hemochromatosis, or some kind of hormonal problems like acromegaly and some glucagon tumors, glucagon producing tumors. These are the things like pheochromocytoma. These are the hormonal, problems related with the diabetes. And gestational diabetes, last but not the least, which is the mother of all non-communicable diseases. So gestational diabetes, pregnancy-induced diabetes, like, the patient may not have diabetes prior to the pregnancy, but develops diabetes during the course of pregnancy. First trimester, this problem is usually not detected. What happens, afterwards, there is increase in the estrogen progesterone ratio, as well as certain placental hormones. They like cortisol, human placental lactogen. These hormones, they do some kind of disturbances, so that some kind of changes, not disturbances, changes in the body. So increased insulin resistance is there. Sometimes, many of the times, like when patients having proper pancreatic beta cell, functioning, they are able to manage. They are able to compensate the increased insulin resistance by producing more and more insulin. But what suppose patients are having some underlying defect in the pancreatic beta cells? So these patients, they are not able to compensate, because this glucose passes through the placenta, but maternal insulin does not pass to placenta. So that, once the maternal glucose goes to the placenta, the fetal pancreas secretes more insulin. So this more insulin, in fact, acts as a growth factor for the fetus, and there is large for gestational aged babies. So detection of gestational diabetes is also very important in the prevention and control of diabetes in future, because all gestational diabetic patients, they do not become diabetic just after pregnancy. So if we have a good control on their diet, weight management, physical activities, advised properly to these patients post delivery, they can prevent the onset of diabetes in them. So this is very important, and screening of gestational diabetes is very important. Normally, 24 to 28 weeks, gestational diabetes is detected. But if whosoever comes to the antenatal clinic should be tested for diabetes, so we can diagnose gestational diabetes early phase, and we can control the things in better way.
All right, ma'am. So as you've mentioned that physical health and diet is very important for a diabetic patient. So what long-term changes can one make in exercise and diet?
Yes. See, long-term changes, as I told you, like you have to reduce your weight. So your caloric intake should be lesser or almost equal to the caloric expenditure. If you are, eating more and exercising less, or you are sedentary, you are not losing your calories. So weight loss is very important by caloric management. You have to have, proper carbohydrate intake, and you have to include complex carbohydrate in your diet. Like, if you are, taking too much rice in your diet, rice is not a culprit for diabetes basically. But what happens, because of the higher glycemic index as compared to jowari, bajri, nachini, oats and all, so there are, it converts to glucose in a faster way. So what happens actually, this insulin takes all the glucose to the target cells. Suppose we eat rice instead of complex carbohydrate, so the blood sugar rises very quickly. So you require more insulin. So it's better. And see, I always tell my patients 3 things to avoid. First is sweets. Sweets mein aapka not only refined sugar, but gur and jaggery and your honey also there. Then second thing is that, all fried stuff. What is the normal, oil intake or, fat intake for a person for a month is only 500 ml per person per month. So we have to avoid all this samosa, kachori, chips, fried items as far as possible. At least we can have them once in 15 days or once in a month, like, we can. And bakery products too, I ask them to avoid. Why bakery products? Bakery products, they have maida, which is a refined flour, and they do have vanaspati ghee. They have which has high saturated fat content, and for a diabetic person, the saturated fat content should be less than 7%, and trans fat less than 1%. So bakery products, they do have all this higher content of saturated fat and all. They have hidden baking soda. They have hidden sugar also. So all these cakes, pastries, croissants and all. So I ask them to keep them minimum, so that you do not, you should not have these kind of things on regular basis. First and foremost is pizza, burger. All these youngsters are very fond of all these pizza, burger things, which includes everything, as I told you. So, but besides that, they can have, carbohydrate, fat, and protein in a proper proportion. They in fact should have 1 or 2 fruits in a day. Like fruits have fine fibers in them, fine fibers, and they help for the cholesterol management too. So in fact, we should include fruits with low glycemic index on regular basis in our diet, like pear, apple, guava. But we can also have sweet fruits like with the higher glycemic index. You know how? Like if suppose you want to have mango, you can divide the small mango half in the morning, pre-meals, and half in the evening time. So you can enjoy the mango also, and your blood sugar will also not shoot up.
All right, ma'am. And is there any kind of infections diabetic patients should look out for?
Yes, they are diabetic. First of all, that diabetes, haywire blood sugar, you are very prone for infections, and your wound healing is also very low. There is a duration of healing is increased with diabetes. So what are the different infections we do get? There are like certain fungal infections, candidal infections, certain kind of bacterial infections are very common. So why do they occur in diabetic patients? Basically, diabetic patients, they do have diabetic neuropathy, peripheral vascular disease, gastroparesis. All these factors, along with changes in their immunity levels, they and inflammatory markers. So these also, they make the diabetic patients prone for infections. So there are certain infections which are not commonly heard, like malignant otitis externa, which is a ear problem. Like so patients may develop kind of emphysematous cholecystitis, or pyelonephritis, or gallbladder infections. As I mentioned, cholecystitis. And Fournier gangrene is also a kind of infection which patients develop in their perineum or genital areas. So we have to look for all these infections. And necrotizing fasciitis is also very common in diabetic patients. So besides the different kind of bacterial infection, fungal infections, these are the I suppose these are the chronic infections caused by diabetes. So we have to look for all these things. So proper to avoid urinary tract infections, we have to have proper hydration. We have to keep the private parts very clean. Hygiene have to be maintained, in these kind of patients.
Yes. All right, ma'am.
And for food specifically, I would like to mention, food has to be examined by the diabetic patients on our own, right? Because they may have interdigital fungal infections. So inter-toe examination is also very important. You have to keep the part, properly moistened, but interdigital, in the web of the toes, you should not put the moisturizer. Because diabetic patients, they are more prone for the dryness of the skin cracking. Then they have calluses. Sometimes they try to remove the calluses on their own. They may develop ulcers. So managing ulcer is also very difficult sometimes. But nowadays, with the various techniques, it is possible to make them, heal faster. Because diabetes is a major cause of limb amputation. This makes the patient handicapped throughout the life. So it is very important to look for the, and to seek the professional help when they develop foot ulcers.
And how does it affect pregnancy? If you can tell us about that.
Yeah, as I told you that diabetes, suppose there is hypoglycemia, the blood sugar passes through the placenta, and the baby's placenta secretes more insulin. That acts the growth factor. That causes macrosomia. So what happens, so patient, when the baby passes through the birth canal, there are more chances of injury to the baby as well as to the mother during parturition. So, and patients, these babies are more prone for hypoglycemia post-birth. They are more prone for low blood sugars. They are more prone for hyperbilirubinemia. They are more prone to congenital malformations. And stillbirth is very common in in these kind of patients, gestational diabetes patients. So we have to monitor the blood sugar levels throughout the pregnancy, and we have to manage if the blood sugars are high, we cannot give them, all the kinds of oral anti-diabetic agents, oral anti-hypoglycemic agents as we can give to a normal person. Why? Because we have to see their effects on the baby fetus. So only insulin and metformin I do recommend for my patients. There are other oral anti-diabetics too, but I do prefer to treat my patients with insulin during the management of the gestational diabetes.
All right, ma'am. And do you have any message for our audience?
Yeah, my message is that we have to involve patient in their own management. So the approach should be the patient specific, according to the patient's priorities. And also patients is more aware of the problems of the diabetes. They are more alert about the complications. So we can prevent acute and chronic complications of diabetes. We can give them a good quality of life and maintain their life in a better way.
Yes. Okay, ma'am. Thank you so much for joining us today.
Sure. Thank you so much. Yeah.
Thank you so much.